A Candida overgrowth in the gut can cause a lot of different symptoms, and these symptoms are so varied that you'd be forgiven if you wondered how they could possibly all be tied back to Candida. And I'll explain what those symptoms are and how Candida can and does cause them. Hi, I'm Dr. Stephen Wangen, the founder and medical director of the IBS Treatment Center. We've treated literally thousands of cases of Candida overgrowth in the gut, and I'm still blown away by how toxic and how problematic a Candida overgrowth in the gut can be. People who suffer from a Candida overgrowth often complain of gas or bloating or diarrhea or loose stools and abdominal pain, but I found that just as many don't necessarily have those symptoms or have constipation instead of diarrhea. And it's not unusual for these patients to have skin breakouts or fatigue or headaches or even brain fog. And that's just a starter list of some of the most common symptoms associated with a Candida overgrowth. Of course, lots of other things can also cause those symptoms, so you can't diagnose a Candida overgrowth based just on those symptoms alone. Candida in low levels is not unusual in the digestive tract, but Candida often takes advantage of our modern day lifestyle to grow to levels far beyond normal low levels. And once it gets to this point, it will wreak havoc with your health. So how does Candida cause all of these problems? Well, Candida is a yeast or a fungus, and yeast thrive on sweets and sugars. In that way, they are not different than most other yeast. So for example, we use yeast to make bread, right? And it feeds on the sugars in the recipe and creates a gas, which causes the bread to rise, right? We also use yeast to make alcohol. So again, it feeds on the sugars and starches in there, and it creates a gas, which is, for example, what makes beer foamy. Now, Candida in the gut is doing essentially the same thing. It's feeding on sugars and starches and creating a gas. And this is why many people with a Candida overgrowth do experience gas and bloating. And when that gas gets trapped, they experience pain, because trapped gas can cause a tremendous amount of abdominal pain. And often you don't even realize that it's gas pain because it just feels so severe you think it must be something else. Now, Candida also breaks down your food differently than your normal bacteria breaks down your food, because bacteria does have a lot to do with how your food's broken down. So once you have a major Candida overgrowth in your gut, you stop digesting food properly. And that can be whether it's a sugar or starch, or even if it's something else, it just doesn't break down the way it normally would. And when that happens, you may feel like you have trouble digesting not just sugars and starches, but virtually any type of food that you eat. Now, this in turn, of course, can lead to symptoms like diarrhea or constipation. Now, why it's one way in some people and the other in other people, I have no idea, to be honest, but I can tell you that I've seen it go either way. So how does Candida cause symptoms like headaches or fatigue or brain fog or even skin breakouts? Here's where I think things get really interesting. Candida create a lot of toxic chemicals. So remember alcohol? We get alcohol from yeast. So Candida is a type of yeast, and it also creates a lot of nasty chemicals, and those chemicals get absorbed from the digestive tract where they're created. They get absorbed into the rest of the body, and once that happens, all kinds of things can go wrong. So this is why many people with a Candida overgrowth in the gut experience things like headaches or fatigue or brain fog. Brain fog is a super common complaint of people with a lot of Candida overgrowth. It's also why Candida can cause skin breakouts or joint pain or a whole lot of other problems, because these toxins end up all over the body. So some people with Candida overgrowth even feel like they're hungover all the time, even when they haven't had a drink for days or weeks. They often describe it as feeling hungover because they are literally being intoxicated from within. And I've not only seen that, but I've even seen a patient who had this to the extreme. He was literally his own brewery. So what that means is he had a syndrome called auto brewery syndrome, and he was basically a little bit drunk all the time. Yeah, wow, I know, no kidding. What a mess, right? That's what Candida, when it's really bad, can literally do to you. Now, why do people with the Candida overgrowth experience different symptoms? Well, there are probably a lot of different reasons for this, from differences in your physiology and your genetics to differences in the different species and strains of Candida that then will produce different types of chemicals. And there are also other types of yeast that can cause problems, yeasts that are not Candida, but other kinds of yeast. So what I can tell you is that once these patients are treated for this problem, they get better. And although that's easier said than done, that's how I know that so many different symptoms can be caused by a Candida overgrowth, because I've seen them in our patients and I've seen those symptoms go away. So I realized that this leads to a lot of other questions like, why doesn't my doctor recognize this? Or how do you test for it? Or how do you treat it? So look for my other videos on these and other topics related to Candida and digestive health, where I discuss all those things. If you found this video helpful, please give it a thumbs up and subscribe to my channel to be the first to get more fascinating information about your health. Thank you for listening.